As exciting as safety is, let's now talk about the thing that we all want to talk about, and that's efficacy. In other words, is this procedure going to work? Well, we have a pretty good body of evidence to show that the chance of you having a successful outcome in the procedure is actually quite good compared to other orthopedic procedures on the market today that are being utilized. So let's kind of go over that real quick. First thing, we have to realize that there are some people that are going to respond to the treatment and some people that are not going to respond. How we figure out how that's going to happen, sometimes it's just by rolling the dice. And I hate to say this, but that can be a good thing for some people who have advanced disease, and you'll find out why in a minute. When stem cell procedures first started to be utilized, people who were younger, people that had less advanced disease, people that had more motion to begin with, people that were more of a normal weight would all have better responses than those people who were older, had more advanced disease, and were heavier from a weight perspective. Looking at registry data, we find that is not the case. If you kind of look at the response rate, it comes down to about a 75%. In other words, about 75% of people who have the procedure done say that yes, it did do something positive to me. And that was irregardless of gender. So male and females did exactly the same. Age, so young people still had a 75% chance, just as much as an older person would. Degree of arthritis, so people who have just a little bit of arthritis had just the same amount of response rate as people who had horrible arthritis. And then finally it was weight. We always hear this when we go to the doctor, oh, if you just lose this many pounds, it's going to take all this pressure off your knee. So we thought that, people that are heavier are going to not respond as well. Ended up not being the case. Still about a 75% response rate. The only pre-treatment parameter that actually showed a difference was range of motion, and that only was in the hip. So people who have less range of motion tend to not do as well as those people who have better range of motion when it comes to doing stem cell therapy in the hips. All other joints, which will include shoulders, knees, and ankles, all showed about that 75% response rate, and it's just kind of a luck of the draw, at least as far as we know right now. Now, all I said was it was a 75% response rate. What kind of response are we getting here? Well, that's where it gets a little bit more nuanced. And so that 75% response rate has to do with people who said, yes, something happened in a positive fashion. So was that positive fashion good enough? Well, they also did customer service, I guess you could call it, follow-up questions to that saying, hey, knowing what you know now and the kind of response that you got, if you could do it all over again, would you do it? In other words, did these 75% of people feel like the procedure was worthwhile? And out of that 75, about 95% of those people said, yes, absolutely, we found this to be efficacious, and knowing what we know now, we would absolutely do that procedure again. So it had a very high customer response ratio in terms of what people thought they were getting for what they were paying for, and did they get the expected recovery and the expected reduction in pain and increase in function based upon their preconceived notion of what would happen. So that's good. Finally, what happens if you did respond and you feel like you didn't respond enough? Can I do this procedure again? And the answer is yes. And right now, studies have shown that kind of the time to do that is somewhere around 9 to 12 months after you get the first initial procedure done. And that seems to be the time when you're going to get additional benefit. And somewhere it's around about an extra 10% reduction in pain over what you had at the end of that 9 months. So you get a little bit extra if you go ahead and do the procedure again if you were a responder. If you did not respond the first time, there's a good chance you're probably not going to respond the second time. So I don't think it'd be worth doing again at that point. And as far as what joints respond best and which ones respond least, well, there actually is a hierarchy of which joints respond best. And it has changed a little bit over the years as more different kinds of joints get done in different numbers. By far, right now, the joint that does the best is the shoulder. Probably because it's non-weight bearing, it doesn't have as much pressure on it. So that joint does the best in terms of response to stem cell therapy. Number 2 is going to be the knee. Then number 3 is going to be ankles and wrists and things. And finally, in last place is the hip. The hip does not respond as well as other joints to stem cell therapy. There are some different reasons why we think, Some of it is that the hip can remodel quite early in its arthritic process, which makes the shape of it very difficult for your body to accommodate to, which leads to decreases in range of motion, which is probably why that range of motion in the hip is the kind of the deciding factor on how we grade how we think you're going to do stem cell therapy when it comes to the hip. If you have good range of motion in the hip, that indicates there's probably not a lot of cystic changes in the bone, which means that it's going to act more normal and more natural after the procedure is over, as opposed to one that has less range of motion, which probably already has big bony changes going on, which the body's not going to be able to accommodate for. Okay, well that's it. I hope you enjoyed this intro to stem cell therapy when it comes to both safety and efficacy of the therapeutic process. Join us for our next video, number 2, when we talk about the actual nuts and bolts of stem cell therapy itself, different ways we go about it, what things to look for, what to expect when you're there, and the timeline that happens when we start running you through the protocol, and when to start expecting pain relief and increase in function. Once again, this is Dr. Scott Nall from thevillageosteopath.com.